Hello, my name is Amy Abbey. I am currently an RN studying for my family nurse practitioner. The PowerPoint I'm going to present to you is my synthesis project presentation for my evidence-based practice for nurse leaders class at the University of St. Augustine. The subject I chose is enhancing medication adherence in heart failure patients. I chose this subject because I feel that it is vital to not only understand the disease process, but also the importance of a medication regimen to help my patients, friends, family, and colleagues help ourselves and others that we love live a happy, healthy lifestyle. This slide is a preview of everything that I will review on and about enhancing medication adherence in heart failure patients. So let's get started. Heart failure is a prevalent and growing health issue in the United States, with approximately 6.2 million adults affected and expected 46% increase in diagnosis by 2030. It disproportionately impacts the elderly, leading to significant hospitalizations and contributing to over 380 deaths annually. To address this critical problem of medication adherence in heart failure patients, this study proposes investigating the impact of a healthcare team medication reconciliation plan compared to the standard care over a 6-month period time. The goal is to improve patient care, reduce healthcare costs, and enhance overall quality of life for individuals with heart failure. Significance of the practice problem. This research focuses on a crucial issue, making sure people with heart failure take their medications as prescribed. This is important because not following the medication plan can lead to more hospital visits, higher costs, and worsening health. This study explores whether a special healthcare team plan can improve how well patients stick to their medication compared to their usual care. It also looks at reasons why some people struggle with taking their medications regularly, like having too many pills or facing economic difficulties. By finding better ways to help patients follow the medication plans, the goal is to improve their health, reduce hospital costs, and enhance their overall quality of life. This brings us to my PICO question. In adults with heart failure, does using a healthcare team medication plan compared to regular care affect how well patients stick to their medications over a 6-month period? We're looking at adults 18 and older diagnosed with heart failure. This includes both men and women and considers various types of heart failure, considers personal habits and lifestyle factors that might affect their health. We are testing a healthcare team medication reconciliation plan, where a group of healthcare experts work together to make sure patients with heart failure not only get the right medicines, but also take them as they should. We will be comparing this new plan with what currently considered standard care for managing medications in heart failure patients. Standard care usually involves basic medication management without specific focus on reconciliation and optimization. The main thing we're checking is medication adherence, which means how well heart failure patients stick to their prescribed medication plan. We're studying this over a 6-month period to see if the new healthcare team plan has a lasting and positive impact on how well patients follow their medication regimen. This timeframe aligns with the chronic nature of heart failure and allows us to thoroughly evaluate any changes in adherence patterns. Summary of search, strategy, and results. To research this subject, I conducted a thorough search in academic databases to find studies that investigate how healthcare team medication plans affect medication adherence in adults with heart failure. I used specific keywords and criteria to include only relevant studies published in English. After screening 85 studies, I selected 8 primary research studies and 2 systematic reviews based on their quality and relevance. The chosen studies will be carefully reviewed to gather important information about the impact of the healthcare team plans on medication adherence in adults with heart failure. This information will be crucial for the next stages of the evidence-based project. Synthesis of literature support for the proposed change. The synthesis of literature on medication adherence in adult heart failure patients reveals a well-rounded understanding from various studies. Some studies highlighted the importance of starting heart failure medications in the hospital for long-term adherence and better outcomes, Others provide crucial information on the prevalence of heart failure and outpatient use of specific medications after hospital discharge. Ethical considerations and patient-reported barriers offer valuable insights, emphasizing the need for a patient-centered approach. Overall, the literature review provides a solid foundation for addressing medication adherence in heart failure patients and guides future research efforts. Description of setting for the plan change. The plan change involves introducing a healthcare team medication plan to help adults with heart failure take their medications more effectively. This might happen in places like hospitals, heart clinics, or during follow-up appointments. The goal is to make sure patients get the right medicines and understand how to take them properly, improving their overall care and health outcomes. The setting should support teamwork among healthcare professionals, use technology for better coordination, and create a patient-friendly environment for successful implementation. Proposed plan change process using a change model. There is a devised and comprehensive strategy to enhance medication management for individuals with heart failure, emphasizing a collaborative approach among healthcare professionals. The goal is to ensure patients adhere to their medications correctly over a 6-month period. By incorporating education programs, clear communication channels, and regular check-ins, they aim to foster an environment where healthcare teams work together seamlessly. The emphasis on ongoing evaluation aligns with their commitment to continuous improvement, ensuring the sustainability of positive changes for the benefit of the patients. Whether this is in the hospital, heart failure clinics, tele-appointments, home health care, or even in the doctor's office. However convenient for the patient to communicate with the team will be set in place for each individual patient. Evaluation plan, including criteria with measures. Our objective is to check if the medication plan helps heart failure patients. This comprehensive evaluation plan aims to measure the success of the medication management improvement intervention through multiple criteria, providing a holistic understanding of its impact on heart failure patient care. The plan aims to check if more heart failure patients are taking their medications as prescribed. This will be measured by asking patients and using electronic systems. The goal is also to make sure healthcare teams work well together and that patients understand why their medications are important. The plan includes regular check-ins and feedback to see how things are going to make changes as needed. They will also make it easy for the healthcare team to share information. The whole process will take 6 months, and they will keep trying to make things better based on feedback. Data collection and analysis. The team plans to collect information using 2 methods: monitoring how patients with heart failure take their medications and assessing the collaboration among the healthcare team. Electronic devices will be used to track patients' medication usage, surveys will be administered to gather patients' insight, and pharmacy records will be reviewed. Simultaneously, healthcare professionals will share their experiences. Patients' understanding of medication importance will be assessed through surveys, and the efficiency of information sharing will be evaluated. These assessments will occur at various points over the 6-month period. Following data collection, analysis will be conducted to identify strengths and areas for improvement. This approach aims to ensure optimal care for heart failure patients. Plan for dissemination. The dissemination plan aims to share the research findings on improving heart failure patient care through healthcare team collaboration and medication reconciliation. Targeting healthcare professionals, administrators, researchers, patients, and regulatory bodies, the plan involves presenting at conferences, publishing in medical journals, conducting webinars, hosting workshops, engaging with the community, and collaborating with stakeholders. The key message emphasizes teamwork, positive outcomes of the intervention, and the importance of patient education. Continuous monitoring, feedback collection, and collaboration ensure the sustainability and impact of the dissemination efforts. This project underscores the importance of healthcare team medication reconciliation plan in improving medication adherence among heart failure patients over a 6-month period of time. Poor adherence has substantial implications, including extended hospital stays and increased costs. The analysis suggests that interdisciplinary collaboration can reduce medication discrepancies and enhance patient adherence, contributing to overall healthcare goals. Proper medical adherence, medication adherence, in heart failure patients is crucial for better healthcare quality, patient safety, legal considerations, and ethical obligations. While this project provides foundational insights, further research and implementation are necessary to fully establish the impact of these medication reconciliation plans. Thank you very much for your time today. I hope I was able to bring some insight to you about this vital subject. I welcome any questions, comments, or concerns that anybody might have about this subject matter. Thank you again, and have a wonderful day.